Okay, we're going to go ahead and get started. I'm going to do a little housekeeping stuff first. So I'm going to read our disclaimer. Um, my name is Dawn, and I am a Master's of Social Work field student. And these webinar sessions are meant to be informational and psychoeducational, and they are not intended to be used as psychotherapeutic treatment. So, should these sessions cause psychological or emotional discomfort, please call Angelo State Counseling Services at 325 942 2371 or the Crisis Helpline at 325 486 6345 for immediate assistance 24/7. So, the topic for today is mental health medications. And we are lucky to have a nurse practitioner with us, Kathy Connor. So I'm going to let her give a little information about her background and introduce herself. So, Kathy, if you'd like to go ahead and start.
Nurse practitioner since 1997, so for quite a while now. I have worked with the ASU students since that time, so I have a lot of background with college students, and then I also have a lot of background with mental health because I worked closely with the mental health counselors in years past. So that's kind of my background. I can't hear you.
I'm sorry. Could you tell us what psychotropic medications are?
Psychotropic medications, that's just a class of medications that's designed specifically to help with anxiety and depression symptoms. There are a lot of variety of classes within those medications. There's selective serotonin reuptake inhibitors. There's norepinephrine reuptake inhibitors. So it's just a broad class of medications that we use to help treat anxiety and depression.
Okay. It has to go along. Anybody has any questions? If you type them in the chat box, we will get to those at the end. So what type of mental health issues would be appropriate for medications?
Anxiety, depression, people that are, we use it a lot for people who aren't sleeping well, and generally not sleeping well is related to anxiety or depression. We have some kids who have a lot of trouble concentrating. They don't necessarily have attention deficit, but they have trouble concentrating, and it may be related back to anxiety or depression, and we can use them to help with those symptoms as well.
Okay. So why would meds be okay for one person, but maybe not for another person who's been diagnosed with a similar kind of disorder?
Okay. Some of it is one person is willing to try the medication and others aren't willing to try it. So that's one reason why medication wouldn't be appropriate. Another reason may be that one person is more acceptable to counseling and responds better with the counseling. Side effects can be an issue for some students or some people. They don't like the side effects, so they don't want to try the medication. And each medication is really geared to that particular person and their symptoms.
Okay. So what are some of the most common medications that are prescribed?
At the ASU clinic, the most common ones that we prescribe are Prozac, Zoloft, Lexapro. We use Remeron, particularly for people that aren't sleeping or if they're not eating, because that helps them, it increases their appetite. It really helps them sleep. We use some PRN or as needed medications like Vistaril for people that have panic attacks. We use a blood pressure medicine called propranolol that helps with test anxiety. So if they've got test anxiety or performance anxiety, we'll use that. Some of the other medications that we use that are not quite as commonly used are our selective serotonin norepinephrine reuptake inhibitors, and those are Effexor, Prestique, and Cymbalta. And those we use when we have a failure, they're not responding well to just like Zoloft or Lexapro. And then we have Wellbutrin, which is not in any of those classes, that works really well for depression, but not so well for anxiety.
Okay. And so what are some of the short-term effects and maybe long-term side effects?
Okay. In the research that I did not see any necessarily long-term excuse me, effects from it other than getting better from it. Short-term side effects usually include nausea, fatigue, decreased sex drive, and for some of the people that we put on it, they don't ever get past that, and others, after they've been on it a while, their symptoms will resolve. But those are typically the more common ones. And then some other people may have an increased thoughts of suicide or self-harm until the medications really get in and start working well. So those are some of the short term.
Okay. How long does it usually take for someone to notice a difference when they start taking those meds?
We can start to notice a difference usually it takes a good 6 weeks, but within about the first 3 weeks, most of them will come back and tell me that they can tell a difference.
Okay. Is it common for the dosage to have to be adjusted maybe more than one time? It's not like just a one-time thing. You have to go back and get it tweaked a little bit?
Yes, it is very common because we always start at a very low dose, and that's kind of to get your body used to it, to kind of minimize any side effects they might have from it. And then we always try to stay at the lowest dose possible that's going to help with their symptoms, help control their symptoms. So it's very common to come in and start at a very low dose and then work our way up till we get to the dosaging that works best for that particular student. And we judge that based on how they tell us they're feeling, plus how they score on the screenings that we do.
Okay. So how long does a person have to stay on these meds? Is this a lifetime thing, or is this something that they can get off of after a while?
Some need to stay on it for a lifetime. Others, if they're in school, I recommend they stay on it at least a year to a year and a half. It depends on how they're responding to it, how they're improving, if they're going for counseling and they feel like they're getting better. But I recommend at least a year of trying on it. And some people can get off of it by the time they get out of college because that's their biggest stressor right now is college. And once they get out of college and they start, they get their job and they get established in their career choices, they feel so much better and they don't feel like they need it anymore and they can stop it. But we always say wean off of it. Don't ever stop it abruptly.
Okay, so that was actually my next question. So if someone decided to stop taking it, so they shouldn't just do it on their own. They should go to the doctor and have them help them do it.
Right. It's best not to do it on your own. It's best to come in and let us help you, or a healthcare provider help them get off of it. And if someone comes to me and says, hey, I don't want to be on this anymore, I'm not going to try to talk them out of it. I'm going to say, okay, then this is how we're going to do it. We wean them off just like we weaned them on it. We wean them off of it. And then I leave it up to them because in about a month, they may be back saying, hey, I think I should be back on this again. And it's like, okay, let's go back.
Okay. So how do drugs and alcohol affect those medications?
Well, if you're talking in terms of drugs, if you're talking about like cocaine and marijuana, those types are depressants. And so even though while you're in your high, you may feel much, much better, but as soon as that wears off, it's going to be worse. So it's counterintuitive to be taking something to help as an antidepressant and then turning around and taking something that we all know is a depressant. And alcohol works the same way. I say if you're on any of these medications and you want to drink, there's nothing wrong with drinking as long as you do it in moderation.
Right.
So an occasional drink is fine, but not an everyday binge drinking type thing, because all you're doing is counteracting the effects of the medication to get you out of that slump.
Okay. And are medications effective without counseling?
They can be. I have a lot of patients that come to see me that they don't want to try the counseling. They just want to do the medication. I think it works better if you do medication and counseling, because I think counseling helps you learn coping skills that may help you later in life get off the medication. It learns to you learn to cope with some of your symptoms and how to recognize them and how to handle them. But the medication works without it as well.
So what would be the process if a student was interested in seeking medication?
They'd come to the clinic. They could call and make an appointment or walk in. They're going to get a screening test in what we call a PHQ and a GAD, and those just help assess their level of anxiety or their level of depression. And that's how, and then we're going to talk with them. So it'd be just like an office visit.
Okay. If anybody has any questions, if you could type those in the chat box, we can, well, Kathy or I or Sydney, whichever one of us, will be happy to answer those for you. Sydney, do you have any questions? Let's. Jalen, do you have any questions? Nicole, any questions for Kathy?
No, I don't. Thank you.
All right. Well, Kathy, is there anything else you think we should know that I didn't ask about?
I just think the biggest thing is there is a big stigma attached to anxiety and depression medications. And I want everyone to know that there is nothing wrong with taking them. It's not any different than having a sinus infection or strep throat and being given antibiotics to get over your illness. It's not an illness. It is your brain just is not working like it should, and it happens to more people than you want to think about. And there is nothing wrong with seeking help. There's nothing wrong with seeking counseling. There's nothing wrong with seeking medication. I just want people to know that it's okay. And when they come to see us, nobody's going to know it unless they go and tell, because we don't talk to mama, we don't talk to daddy, we don't talk to big brother, we don't talk to professor, we don't talk to anyone. So there's confidentiality in it. And if anyone has questions about it and they just want to come in and talk to one of us, either myself or Toby Redden, we'll be happy to talk and try to point you in the right direction.
Okay. And could you tell everybody what the phone number is for the clinic?
It's 942-2171, but I think sometimes you might have a little trouble getting through with that. So you can call 658-1511 and ask for the Jackson ASU clinic.
Okay. All right.
I'm sorry. I do have one question.
Okay.
I was very interested. in the fact that you were saying sometimes people will go on anxiety or antidepressant medication and not attend counseling. So is the assessment process, like, do you have that particular client come in more regularly to be able to kind of monitor how they're doing on those medications, since you wouldn't see them in conjunction like with counseling?
Yes, we do. When we first start people on medication, we usually have them follow up within 2 weeks. That gives us an opportunity to know how they're responding to the medication, whether having any problems with the medications, any questions that they may have come up with between the first time we saw them and that 2 week time period. And then typically, if we adjust their medication in that 2 week period, we see them again in another 2 week period. Once we feel like they're stable, then we may see them every 3 to 6 months. But until we get them to a point where we feel they're stable, we're probably going to see them every couple of weeks to a month at the longest time.
Okay, thank you very much.
Mhm.
And do we have any other questions? All right, I want to give the counseling services phone number again is 942-2371. And the crisis helpline, that's available 24/7, 365 days a year. And it is 325-486-6345. So give us a call if you have any questions about today's webinar. We did record it, so it will be on YouTube later on our YouTube channel. But if you have any questions, let us know. And Kathy, thank you so much for coming and interviewing. Let me interview you. We do appreciate it. And thank y'all for participating. And we will see y'all in 2 weeks. Thanks.
Thank you, Kathy.
Uh-huh.